The Siyayinqoba team went to Indwe in the Transkei, where we met up with Zoliswa, a treatment activist.
I didn't sleep last night. I started writing a report to my colleagues out there. I would like to come as soon as I can to Indwe to start our education programs in this place. I think it needs, people here need some help. They are our people. Our people are dying.
Together with Zoliswa, we met Nundu, who is HIV positive. Nundu has been suffering from severe thrush. Oral thrush is an opportunistic infection of HIV, which affects the mouth and can spread to the food pipe, making it hard to swallow. Noluntu's thrush was so bad, she could hardly speak to us.
Gaba treatment and don't like sebenzisa.
Akana treatment ngoko.
As into sebenzisa garlic ne lemon juice. Akana nto straight. Ingenye ityayo.
Bekufanele nje apha ezibhedlele zeni naseziclinic zikhona iipilisi. Zikhona iipilisi ezinceda lento nazo kuthiwa iflu khona zo. Urhulumente ezopilisi zikhona zikhutshwa nje mahala azithengiswa.
When I first saw Noluntu Komani, her condition was so serious. She couldn't walk, she couldn't talk, she couldn't swallow.
From there, I decided to go to hospital to see the sisters. How do they treat people? I met a chief professional nurse. They took me for the rounds around the hospital. Why don't you order the necessary medication so that we can help? If we only know the reason why, in your hospital.
We must try and sort it out. We didn't know. And they're effective really, as we hear from and we read from the books.
We met the pharmacist together with the medical manager. I asked, why doesn't she have the fluconazole in the hospital? The pharmacist said,
we know about it, but as Mr. Waskachni told you now, that the government didn't tell us about, to order it in that state.
This is treatment for opportunistic infections. Each and every opportunistic infection is treated, and no patient has to be sent home to die because there's no treatment for opportunistic infections. What I saw here was so painful to me, and knowing that people are dying and there's nothing that can be done. Treatments are there. There is treatment. It is there. By law, it is there. It has to be distributed to all of the hospitals for our people, but in some hospitals it's not there. For the reason I don't understand why it is not here in this hospital.
Nobody let us know about this, so but we're going to do
to order it. In the first order that you are doing, you should supposed to order the fluconazole. This treatment for opportunistic infections should be here by next month when I come here.
We can be very glad. Because there is that process.
They promised to call their supervisors and ask why are they kept in the dark.
2 months later, we went back to Indwe to find out if their local hospital kept their promise and started providing treatment for opportunistic infections of HIV.
We're using fluconazole? Yes. For trust is very good and it's effective. Really, it's also another thing that we have discovered it from it. A patient once have taken it, he also developed appetite. She started to have more appetite. So it's very effective, really. It's working, this treatment. We are so happy to have it.
We also paid a visit to Noluntu and her doctor to see how she was doing.
Molweni. Ninjani mama? Asikhona nathi. Akhondo. Nawe Noluntu uphilile?
Hayi nami ngiphilile.
We. Yini? Lokugqibele nonke impilo ikuhlupha uziva njani namhlanje?
Hayi noko. Betere.
Ubhetere ngoku? As soon as we had fluconazole supplied to us, she did get her first course of medication. Okay, blood pressure yakho nokho better, right kakhulu. Anyukanga. Noko ngoku. Fakala ku better. Perfume. Ezo pilisi zibutshintshile ubomi bakho.
Ziphi ngoku bezilapha? Phambi koba ezipilisi azifumane ebengakwazi ukwenza into ngoba ubingumuntu okhala ngomqala ukutya engakwazi ukuginya engatyi kungekho nto ayenza ibingumuntu ohleli nje elele pha ebhedini.
Nanga manzi. Mna ugula kwam ndagula nje ngento nje ndasuka nje ndaxi into apha ndogqiba uthi nkqi apha into kwasuka kwarhawuzelela nemiqala yonke loo nto yabuhlungu kwam ekubeni ke ngoku ndafumana la mayeza ipilisi ndafumana ipilisi ndafumana neyeza kwangathi kuba bhetere. Ezi pilisi zithatha iintsuku ezi-8 ndathanda nokutya ndathanda nosebenza bendingathanda usebenza soloko ndithanda ufuna ulala ufuna uthini. Ewe ezi pilisi zindincedile kakhulu kwinto bendiyiyo kuqala.